The number of people known to have died with coronavirus in hospital passed 20,000 today, a sombre milestone. It means Britain has become the 5th country in the world to register that number of deaths from the illness. In the last 24 hours, 813 people are reported to have died, mostly in hospitals across the UK. It brings the total UK death toll to 20,319 people, but that figure doesn't include deaths in care homes or the community in England and Northern Ireland. At the daily government press conference, the Home Secretary Priti Patel described the deaths as tragic, but admitted the country isn't out of the woods yet in its fight against coronavirus. Here's our health correspondent Lauren Moss.
It is a devastating milestone no one wanted to reach. In less than 2 months, more than 20,000 people have died with COVID-19. These are deaths recorded mainly in UK hospitals. The number of those who've lost their lives in the community, including care homes, isn't fully known, but is likely to increase.
As the deaths caused by this terrible virus pass another tragic and terrible milestone, the entire nation is grieving. My deepest sympathies and condolences go to those who have lost loved ones. And I would like to pay tribute to the selfless frontline workers who have been struck down by this virus.
On the 28th of March, Professor Powis, you said we will have done very well if fewer than 20,000 people died during this epidemic, and we have sadly passed that number now. Does this mean the strategy should have been different?
This, unfortunately, is not going to be something that we will get over in the next few weeks. This is something that we are going to continue to have to work our way through over the months ahead. As I've said before, this is not a sprint. This will be a marathon in dealing with this virus.
Test, track and trace are key strategies to tackle the virus. The drive to check key workers with symptoms continued today. And there's a big demand. Within a couple of hours of the government's booking website opening, slots have been quickly snapped up once again. When we looked this morning, home test kits were gone after 15 minutes and drive-through sites were only available in Scotland after 10 a.m. More tests will be available tomorrow.
The cough isn't as bad as it was. At one point I was coughing nearly all the time.
Mandy works in a supermarket in Derby. She's been unwell since Monday. She has got an appointment, but even though she lives near some test centres, she's been allocated one 20 miles away in Nottingham and can't get there.
I just don't understand why, when I know that there are test centres closer to me, why they're not on the list of options for me to go to.
More than 28,000 tests were done in the last 24 hours. The government's committed to carrying out 100,000 a day by Thursday. Next week will be our 5th in lockdown, and there's no prospect of measures being relaxed.
We know that people are frustrated, but we are not out of danger yet. It is imperative that people continue to follow the rules designed to protect their families, their friends and their loved ones.
The UK will continue to find a way through this pandemic as a nation mourning those it's lost.
And Lauren joins me now. Lauren, these are deeply sad personal tragedies for many families across the UK, but can you put that number into context for us?
The first person to die with COVID-19 in the UK was on the 5th of March. Then 3,000 people around the world had died. Now we've passed more than 20,000 deaths here. Internationally, 200,000. And this is a very real and harrowing insight into just how quickly this virus spreads, and also shows why lockdown measures and social distancing measures are so important. And one of the graphs we were shown at the press conference earlier demonstrates how it's working. There are 16,500 people being treated in hospital for the virus. And as you can see overall in London, the Midlands and Scotland, new admissions are declining. They're steady in Wales. There has been a slightly slower climb up in Northern Ireland, although this data isn't compiled daily, so it's not directly comparable with the others. But the health service hasn't been overwhelmed. And in fact, aside from COVID-19, there are concerns that fewer people are seeking medical help for other illnesses, conditions like heart conditions and stroke, or pregnant women and sick children. And A&E attendances actually were down by about 1 million this month compared to this time last year. And this could be because people don't want to be be a burden on the NHS. But the NHS is urging and reminding anyone who may need to see a doctor to do so, because, of course, although the coronavirus is a huge challenge, other illnesses do very much still exist, and it's important that they don't go unchecked and become forgotten.
Laura Moss, thank you very much indeed. In the last few minutes, it's been announced that the Prime Minister will return to work on Monday after falling ill with coronavirus. It'll be exactly 3 weeks after Boris Johnson was moved into intensive care following his admission in hospital in London. Well, our political correspondent Ian Watson is at Westminster for us. So, Ian, is Boris Johnson fully recovered?
Well, Tina, Downing Street are emphasising that the Prime Minister has been following medical advice throughout this crisis since he was first diagnosed about a month ago. And what is interesting is that although he was supposed to be recuperating at his country retreat of Chequers, in truth, he's been spending most of the past week preparing for his return to work in Downing Street. Not just those calls with President Trump and with the Queen, but also daily video conferencing with his team, and significantly, a 3-hour summit with some of the senior members of the Cabinet, including his de facto Deputy Dominic Raab, and crucially, the Chancellor as well. But when he sets foot in Downing Street, he will face a whole series of challenges, because there are mutterings from some of his own MPs about the lockdown and the effect it's having on the economy. The former Chancellor, Philip Hammond, suggested that perhaps indeed the economy could become the greatest victim of this virus. He's also going to be receiving a letter from the opposition leader, from the Labour leader, Sir Keir Starmer, who's calling for greater clarity on how we'll exit the lockdown in due course. Now, I think when the Prime Minister does make some announcements, unless I'm told we're likely simply to see modifications to the current measures, he's very keen to avoid a second wave of this virus. And interestingly, at that Chequers summit I was mentioning, he apparently quoted the Roman philosopher Cicero. I mean, he would, wouldn't he? In English, the phrase he used is that the health of the people should be the supreme law. And I think that gives us a big clue about where Boris Johnson stands on this lockdown debate.
Ian, thank you. Ian Watson at Westminster for us.